In today's video, we are going to talk about post-operative care for a patient who has had an emergency trauma of the head. Post-operative care is a care given to a patient after surgery through to the time before discharge. The patient I'll be seeing is a minor, that is age below 18. So the conversations or treatments that will be done will be between the patient and then the mother or the next of kin.
Yes.
Good day, Mrs. Enin and George. How are you all doing today?
We are doing well.
How is George faring?
Getting better.
Okay. Alright. So I'll be coming to check his vital signs and then see if there's anything you need.
Okay.
With my hands sanitized and privacy ensured, I then proceed to check his vital signs. So I'll check his pulse, his respiration, and then his wound site, and then catheter. Hello, George. How are you?
I'm fine.
So I'll then put this underneath your armpit to check your temperature. Okay. I hope you're fine today. I also proceed to check George's glaucoma scale. For now, I checked eye response, which was 4, and motor response, which was 6. His temperature read 37.2 degrees Celsius. That was normal. So you then sanitize. We proceed to check his pulse as well as his respiratory rate. His pulse was 80 beats per minute, and then his respiratory rate was 20 cycles per minute. Can you please tell me what your name is?
George Enin.
Do you know where you are?
Yeah, in the hospital.
So with the questions asked and the answers given, you realize that George is oriented to time and place. So then you could conclude that he had no complications right now. Since George had an emergency trauma of the head, you would have to check his reactivity to light and then his reflexes. So George's pupils are equal and react to light, and then his reflexes are normal. You wear your gloves. You then check to see if the infusion is flowing as it should. Do not change the rate at which it's flowing since it's not your job as a nursing assistant. You then check his site of surgery for any soilage or blood. The dressing is clean and dry. There's no spillage or leakage, and there's no presence of blood. You then proceed to drain his catheter bag. His urine catheter in situ is French catheter. His urine output is 100 ml, and then the urine is clear. So you assess the skin for any sign of dehydration, and you check the infusion site to see if there's swelling. You'd also make sure that the patient is comfortable. For head trauma, we advise that the head should be elevated above the bed about 30 to 45 degrees. So you use a pillow in support of that, and you try to change the position of the patient either every 1 to 2 hours. So since George is resting, we'll let him rest. But then during the day where he's active, we'll then advise him to sit. Since George is a minor, you then proceed, ask the mother some few questions, and then you discuss the further management or treatment plan with her about George's condition to ensure that George's treatment would yield to good recovery. Hello, Madam Georgina.
Hello.
Okay, so I'd like to ask you a few questions about George. Since he came back from the surgical room, has he vomited?
No.
Has he had any complaint of headache?
No.
Dizziness?
No.
He could see clearly, right?
Yes.
Okay. Has he had any complaints so far?
No.
At his side, maybe he feels pain there?
No.
Okay. Alright. So for now, we would still keep him meal per hour, that is, no food or liquid per mouth
Okay.
till tomorrow morning.
Okay.
And then from tomorrow morning, we'll start with fluid diet. So we'll start with small sips of water. Then we'll migrate to cocoa, and then porridge and tompan or oats. And that'll be for the first day. So as time goes on, we'll still be checking him. So from now to tomorrow, we'll check him after 30 minutes. Someone will come and check him, and then we'll do that 2 times. Then we'll shift to every 2 hours. So tomorrow morning we'll come and check him, and then proceed every 4 hours. So morning, afternoon, and evening. If there's any complaint, we could report to the nursing assistant, that is me, or then I'll tell my supervisor if we tell any health professional.
Thank you.
Is there any questions you like to
No.
ask?
Thank you very much.
So these are the instructions that I received from my in charge. So just in case they have already told you, I'd like to reinforce those instructions.
Thank you.
Sign of projectile vomiting is not good in a case of trauma, since it would show an increase of intracranial pressure. You then proceed to record his vital signs onto his treatment plan, treatment chart, and then you thank the patient and the mother for cooperation.